different things. Then they make person they sick. Sick and they come like that. Disease or different things. Then and many of them now be disease. Now be make we they sick. Get people they won't be say they head sharp well for matter when be say concern disease well. We go bring them maybe say they come talk to us. What is the cause of this kind of disease? What will be this kind of disease? How will take do and be say this kind of disease will not get them? How they come out safe? We want to talk to people that maybe say they talk to us for this matter, and then they come from they come join us because say for time when we say not they go do the World Pathology Day. That one a big grammar. World Pathology Day. They go tell us the meaning of pathology because the one meeting I checked just now, when my head carry me is a disease. So you go tell us what it be. So we get two people here. We get Dr. Madam, that's your name. You go help us call him again. Dr. Ibowa. Okay, welcome to our program. Thank you. We get Prof here, Professor Ogiagbe. You tell us the first one just now. Ezekiel. Okay, that be a name, and all of us go look this matter when we say concern pathology. You get one of our bra here when we say they give us support from the back. Yes, a day for here to now. Dr. B, Dr. Jeremiah. I'll get your other name just now. I'll tell you when we see the time reach. They will tell us here they give us support from back so that it is they go work our way. Madam, make I start from you because we go school. We all know go school. Here say ladies first. Other people add on say after gentlemen anyway. But we'll go start from you because I get so much respect for you, madam. I want to ask you, what will be this one won't be said they call World Pathology Day? What will it be?
Okay. Pathology is the study of diseases. So for pathology, what they do mainly now how to find out what they cause the disease, how the disease don't reach, and then how to help other doctors. Okay. We will tell them what exactly we see for the person, maybe for any part of the body where they bring, like urine, blood, we go check and then we go find out which kind of disease we see for them.
So pathology now be disease?
Yes.
Okay.
Study of disease.
Okay.
Yes.
If I won't find out now, okay, so I'll tell you, we'll go meet you, my brother. Why they come get special day for this one, maybe they call pathology? Maybe just for Nigeria here, come be an award, now global thing. Why they come get special day for them?
People, now good morning. Today, we will tell you about pathology. My sister don't already tell and say pathology is the study of diseases. Not just to study them, so that when we don't study them, we use them to help our clinicians to treat the patients.
Okay.
You know, medicine is a very broad area. In medicine, you have diagnostic aspects. And this diagnostic aspect then divided into two. You have imaging, those where they do X-ray, ultrasound, and those where they lab. Those ones will take body tissue to make diagnosis. And this body now, as we be, you know, say some parts, they solid, it's strong. Others now liquid. So pathology now, some they use the solid tissue to make diagnosis. Others don't collect blood, like my sister talked just now, urine, physics, they make diagnosis. Because other doctors, who are not pathologists, then just they guess or then just they suspect. And when the pathologists don't make the diagnosis, don't confirm out, now don't fit talk, so, okay, now the disease be this, so don't give them the drug, we go fit treat them.
But you never answered the question when I asked you. Thank you for this one, ABC you talk. Yes. I said, why they can't choose one special day? When they come to say, yes, the whole world, because this is now World Pathology Day. Yes. Maybe Madam will help us from there.
You know, almost every specialty, they get special day when they celebrate their specialty. For example, now, this also get World Day of Journalism.
Yeah, we get.
So, World Pathology Day, now the day when they tell people what they do. What pathologists they do. Say pathology, they exist for hospital. And this now what they do, they help other doctors. They find out exactly what they wrong with the patient, so that they will
continue from there. Okay. This kind of things then, they get some kind of common disease there when we say what they get. I don't know whether you feel help me. Just put small lights. This kind of disease happen till they get them. Just maybe one or two. What do they make cause they get this kind of disease for body?
You get different things when it cause disease. Some now just the way they born them. call
Okay.
am genetic makeup.
Okay.
So from their genetic makeup, that one fit cause some disease if some things dey wrong with the genetic makeup.
Okay.
And then some na from the environment they fit get that kind of disease.
Okay.
You go acquire from some na through the kind of food wey you dey eat.
Okay.
You fit get that kind of disease. So you get different things wey fit cause disease.
Okay. And this kind of thing, I want to say the person already get the disease now. They already reach hospital and the rest. So because when we dey grow, we not say, you know, well, we'll go see doctor. We just go see doctor. You don't understand? So now we come to us say, yes, say the doctor get one side, the doctor get on that side, every different doctor get on that side. So after I don't do a finish, now we say now still give on that doctor again. One what you get the thing we call that call and clinician, be I take call and just now.
Yes.
Now me say yes, say even so yes, say I don't already know. Say these are the disease. The person never still well. Maybe you tell us from there.
Yes. As we dey talk go so, we said what pathology dey, why would they do am, and to enlighten people.
Okay.
And who qualify as pathology.
Okay.
You know, say the people where they assign to treat people for this country, na doctor.
Okay.
But that doctor, they get very many specialty.
Okay.
So we don't really talk say pathology na the study of diseases.
Okay.
Then the people where they do the pathology, they call them pathologists.
Okay.
And waiting to qualify you for pathologists, you first be medical doctor first to,
Okay.
not just to open lab, they do test. Then when you don't be medical doctor, you can still spend another 6 years to specialize to be the pathology. And this pathology now, like we stop, because the enlightenment now we get different aspects. So we get those, like you they asked just now, what they cause disease? Some the microorganism, some from the environment, some contact with people, like communicable diseases. Those way they deal with organisms, that they call them medical microbiology.
Okay.
Then those also, because some disease they not be organism they cause some more, like waiting with they eat. We fit call them some metabolic disorder like diabetes. How you fit to make this diagnosis? Like to collect blood, test for the sugar. So the people where they test all those analytes, electrolytes for inside body, that they call them chemical pathology. Like that one my sister did. Then other people they when you talk say they bond them with the disease. Like
I should still talk to.
like sickle cell now. Now blood disease. Others they. Then the people where they manage those ones, they call them hematologists. Then the fourth one will be histopathologist or pathologist, that qualification. Now be morbid anatomy.
Okay.
Waiting those ones they do. When you say, okay, this person get cancer, the only person for this world or the only pathologist will qualify to say, na cancer did this body or this tissue, na histopathologist. Those ones will collect the biopsy, small sample, look under the microscope to make the diagnosis. And one person don't still die, say, waiting kill this person. And still pathology, and I go do the autopsy.
Okay.
So you know, say he big well.
Work big.
So when the person they alive, na pathology go help am make diagnosis.
Okay.
When the person don't even die, say okay, then kill him, or he die by himself. Na pathologist now you still call. Something don't happen for this world recently, which is a global pandemic. Because of that one, a lot of things don't they modified. So what thing we get now, na really an abridged version of our pathology week.
Okay.
Like today now, an enlightenment program, like what thing we dey do now, to tell people what our work be. Then tomorrow we'll still give lecture, Zoom lecture, so that many people will join us. And the top people will get now COVID-19 and the impact on clinical laboratory practice. So now that one. Then before we fit do go on campaign, do screening, free screening. And the other thing we are not talk, say what they do, not only to make diagnosis, so we also to screen people. Say before you get the disease, you fit catch them young and you can't prevent them. And the common one for this environment now, which many people do now, they call pap smear.
Okay.
We will just collect their sample, look at. If we say they normal, then that person don't get the disease. If it's quarter to, we get with him we do, then that person don't get the disease again. Like our sister where they lab, then they do screening, waiting with they call screening. Some markers they weigh they blood. when you take them, like for prostate now.
And that be the drive they go because they say that one. Let's say before I reach there, don't reach there because that be one thing when we say we hear say is the key most medicine and men disease. Yes, be that one. Yes. And men killer that be that one. I don't feel like we dey here. Now able keep my past self. You understand? So in this kind of case down for prostate cancer, maybe madam will help us. I understand man will like be, but you go see know what to teach about that. You go help us now. What did the man would do? Or how not go fit check this kind of thing so that you know can go turn to something else for the man, but they may not go taking life at the end of the day.
For men, once you don't pass like 40 years, you're supposed to come lab their blood to check for what they call prostate specific antigen.
Okay.
That be the thing when they increase for man body if you get prostate cancer. But if it increase reach one level where we say not be cancer, maybe the prostate just big. But you get the way it go increase reach, we'll say most likely this person gets prostate cancer. And if you fit detect them on time, they will fit treat you, will fit live longer.
Okay. So you not get high, basically the fit say the thing be must because one don't they hear cancer now. They see the operator on board. They want to give a medicine, maybe say a drink so that you go take suppressant or something like that. Or the thing must big come at the end of the day, see kiddie man.
No, most times they big, then you get some medicine when they'll fit give.
You come make them small again.
They fit. Then most times now surgery, operation like they do to remove the big prostate.
Oh, okay.
Yes.
All right. So maybe you would like to tell us for another disease now before BC I will let you come out on another thing when BC yes and I want to make BC people know before BC we will leave here because time will be our friend again.
Okay. Like diabetes now, one common disease. For our environment. Before now, not plenty like that, but because we don't they eat the kind of thing where we go they eat. So diabetes don't do plenty for our side too. So for us to catch people on time, we could make them come they check their blood glucose. Then for those who get diabetes, we could say make them they check for what they call glycated hemoglobin. That one at the thing where they check the quantity of glucose when they in the blood. You go check them, it go tell you how much glucose in your blood for the past 3 months. So that they go know whether you really they take your medicine well, whether the blood sugar that they really the medicine when you take really they control the blood sugar well.
Okay. So this one will be say before I go let them come on. Because this kind of business they do, it's not they do some kind of screening and all of that, and because of COVID-19, and people not going to enjoy that screening again.
Next time, now every year.
Okay.
So we'll prepare where we'll go down.
So by next year now,
yes,
we'll get free screening that time.
Free screening,
and the rest. My people say we talk with our people then when they celebrate doctors, professors, that when they celebrate the World Pathology Day, they don't tell us so many things that when we say concern diseases, and I know say yes, they don't let 1 or 2 things there from Madam, we greet you so much.
Thank you,
Professor Ezekiel Ogiagbo, thank you so much. I want to thank
you,
our brother too, Dr. Iguma. Jeremiah Guma, well, thank you so much for the one you say you do. God continue to bless you and say they push us, they go. We'll take a small break now. When we come back, continue for where we stop because so many other matters there when we say we will people math. Not go anywhere, stay with us.